The Democratic Alliance is putting pressure on Health Minister Dr. Zweli Mkhize to place the Eastern Cape's Health Department under administration. Now, that province has been battling with shortages of critical care beds and equipment, as well as shocking conditions in some of its hospitals. Now, a team deployed on an inspection visit to the Eastern Cape, led by Mkhize's advisor, Dr. Sibongile Zungu, encountered a disturbing picture of the health system, saying it was under distress. Let's unpack the story now with the DA, Siviwe Gwarube, who joins us now from Cape Town. Siviwe, thanks for your time this morning. You know, it's disturbing that it took a BBC report to get some real attention on the issues in the Eastern Cape healthcare sector. We know that our own journalists here at home have been reporting on these issues for years now. So why the decision from the minister not to take over the administration of a department that is clearly crumbling, if not already crumbled?
Yeah. Good morning, Michelle, and good morning to your viewers. It is disturbing for me that the pressure has to come from international platforms, because we have indeed been receiving news about the state of healthcare in the Eastern Cape, not just during COVID-19, but also before that. In fact, that department and that of the education have been placed under administration before because of some of these very issues. And so now what we have is a situation where we've got inadequate administrative leadership in the province and political leadership. And our view is that we can't be in a situation where we are making political considerations while people may be dying unnecessarily. And so our view is that the minister is empowered to make a Section 100 intervention, and that will force the department and will force the province to essentially adhere to strict national guidelines. What he has done instead is to send a team of essentially project managers into the province. But our view again is that this will simply be a mere suggestion if it is not empowered by a constitutional intervention. It's simply not enough for the minister to keep making weekly visits to the province and then discovering new things that are wrong, like he did when he was there a day ago, and where he realized that the province wasn't reporting on deaths as they should have.
So, Siviwe, for the sake of our viewers who perhaps didn't see that BBC report or the other numerous reports from our local news outlets, it's a disturbing picture to paint, but paint us that picture of some of the scenes we are seeing at some of those hospitals in the Eastern Cape.
Michelle, it has been, it's truly, in my view, a constitutional, crisis here, because ultimately the Constitution does provide, does give South Africans the right to health as per Section 27. And what we have there is a denial of that right in a very real way. We've got hospitals like Doranginza and Livingston Hospital where patients have had to fight each other to get access to oxygen tanks. The conditions in the hospitals where doctors and nurses have tools down. Essentially, we have mothers giving birth in maternity wards on the floor because there aren't enough healthcare workers there to provide the service, where there aren't cleaners to clean, and blood-soaked water is running through the floors. And so really no South African should have to be subjected to that kind of treatment. But also, more importantly, something that we don't talk about often, is that no healthcare worker should have to essentially work under those conditions. Because while healthcare workers have taken an oath, it doesn't mean that they need to essentially put their lives on the line to be able to provide that service. And so this is a multi-pronged approach. And I think, even if we do allocate extra resources to the province, if you don't have a strong operational team that's going to be able to prioritize, that's going to be able to provide PPE, making sure that we've got healthcare services closer to the people, those resources are simply going to be squandered. We've already seen in some parts of the country where even PPE contracts have been subject to corruption. And so that is why we believe that stricter management of this department is needed.
I mean, it's a bit late, isn't it, this week for us to be sending a team of specialists to the Eastern Cape to now evaluate what the needs are in the midst of COVID-19. We're on the back foot in a very, very real way, and we saw that this week when we saw that 400 deaths reported in one day in that province.
Absolutely. We had the Department of Health from the Eastern Cape with us in the Portfolio Committee the day before yesterday. And they painted a very, very disturbing picture where they were plotting where there are gaps in the system. There are areas that are covering over 300 to 400 kilometers that don't have a single critical bed allocated to them, a single one. That means that patients have to essentially travel 400 kilometers to a central hospital in Amtata. Alfred Nzo has no critical beds allocated to them at all. And we've got issues with EMS in the province. And so again, as you say, we are on the back foot, and sending in that team is not going to help unless you bring in a very strong constitutional intervention to say that the province, it's not a mere suggestion that we demand excellence for that province. It is now a matter of life and death for the people in the Eastern Cape.
No, absolutely. That is essentially what it means. So that what it boils down to, Siviwe, is that it's not necessarily COVID-19 that's causing massive deaths, but it's the lack of the infrastructure, because how can it be that within a 400-kilometer radius there is not access for the people who need it to a critical care bed?
Exactly. And that's what we've seen. We've seen what 2.5 decades of neglect can happen. And that's what, and a lot of analysts have been saying, that what COVID-19 has shown us is not how well we respond to the crisis, because we can all acknowledge that there's been some commendable interventions from the Department of Health, from Minister Mkhize. But what it's shown is that actually the neglect of the health system for the past 2.5 decades is now what we are contending with. And now what we have is a situation where people are going to die where they shouldn't be dying, and there's nothing we can do unless we really intervene. And that is the crux of my input to the minister yesterday during the budget vote, that it would be amiss of us to throw our hands in the air and give up now. There are interventions that we can take now that can at least save lives, maybe not save the state of healthcare in the Eastern Cape, but at least save lives. And we can't actually just allow that not to happen.
So what is the next step, particularly in the Eastern Cape now? The minister, from what we can see, is doing a political tiptoe around not taking over administration of the health department in that province. So what happens now as we continue to move towards the peak of infections around the country, in the Eastern Cape and Gauteng in particular?
Look, I mean, it's speaking about particularly other provinces such as the Gauteng and KZN. It's important to also keep notes, to keep an eye on that. And one of the recommendations that we have put forward to the minister is to say, you know, if infection numbers are tapering off in the Western Cape, I think we saw a great cooperation between national and provincial government in that Western Cape. And I think that there is room to say that staff that have been leading the response in that province can be seconded to other provinces. Extra additional resources that were allocated to the Western Cape, where they are not necessarily needed anymore, should be allocated to other provinces as a matter of urgency. And then I think it's also important, Michelle, that the minister, you know, abandons the denialism about what is needed, because he himself has seen that his weekly visits won't do anything if he gets there and he's told that in the past week we haven't reported on deaths. And so we will continue placing pressure on him to make the case that unless there is strict constitutional interventions, this is what is going to continue to happen in the Eastern Cape. And we've committed ourselves to making solid and substantive suggestions to the minister and his team, because ultimately it's not about political scoring, but it has to be about saving lives.
Well, I'm very happy to hear you say that. And as you say, Dr. Zweli Mkhize, the health minister, has done, he and his department and the other officials working with him, they've done an incredible job in so many other aspects. Now is the time to start plugging these massive, massive gaps in the system, ultimately to save lives. Thanks very much for your time this morning. The DA, Siviwe Gwarube, joining us there via our Skype line in Cape Town as we continue to track government's response to COVID-19. Today our discussion particularly centering around the Eastern Cape.